The COVID-19 pandemic is caused by a new virus that we are still learning from. And one of the things that we are learning, unfortunately, is that it's disproportionately affecting people of color in the United States. Black African Americans are disproportionately represented among those who are dying from COVID-19, and Latinos are overrepresented among those who are being infected by COVID-19. One of the challenges that we have, and perhaps one of the best examples of racism and discrimination in healthcare, is not collecting enough data about race and ethnicity. Currently, only few states are required to capture the race or ethnicity of those who are being tested for COVID. So even the data that we have to make decisions is not good enough.
I do believe redlining, gentrification, alongside poor housing conditions have an influence on public health in Black communities. It limits access to testing, healthcare, free sites, as well as government assistance programs, equal representation and advocacy for our communities when it comes to addressing Black public health. A community where there may only be like a clinic or a smaller hospital where they don't have like the necessary staff or PPE or appointments available to see patients, you'll have higher mortality and morbidity in that area versus an area that has like adequate resources. Some non-Hispanic Black communities, they may not have necessary funding and opportunities as to where they can take off work and, you know, attend to their families. So I think it's a combination of interpersonal and interpersonal factors to help you like maintain your quality of life and or change it. So when I first heard the comment, I was disgusted because I didn't think at the time that there was a lot of cases in Africa when when they were discussing this as a measure. And it brought me back to like the Tuskegee experiment, thinking like, what were the conversations and the questions to say like, okay, let's start here rather than a hot spot where, there obviously needs to be the clinical trials and the experimental drugs put in place. And it just made me think about like the value of African and African American lives worldwide.
There's a longer history of exploitation of Black people and Black bodies by the medical field. And so we can go back to the ways that enslaved Africans were understood to be more sort of tolerant of pain. We can think about the ways that physicians examined enslaved people at the auction block, the ways that physicians were hired on slave ships, right? So historian Charlotte Fett talks about soundness, this idea that enslaved people interacted with medical care not for any kind of holistic approach to care, right? But for an idea for the purposes of making sure that a person is sound in body enough to work. So on the one hand, you have a population that has historically been framed within medical discourse as needing to be just sound enough, right, to be laborers. And then you move from people of African descent being framed as, by the larger medical establishment, as subhuman, to then being the subject of experiments as the medical field became professionalized.